So what can a patient do who's seeking a reputable office? What can they do to ensure that they're not going to get scammed?
I would say, honestly, for cosmetic procedures, stay away from anything like that seems like a chain restaurant.
Yeah.
Like that's first and foremost.
Anything that's being publicly traded.
If you're publicly traded, if you see...
Because even air sculpt was a hot commodity, and it's
2
years
years ago.
Yeah,
And now
and then they were searching. Yeah, they were searching for physicians to come and join them. They kept on asking us.
So another
they pay us a small fee.
Another main thing is a lot of these places also, the way they make it worthwhile for the physician is you don't need to follow up. They'll do all the follow up. So you want to make sure your pre-op and post-op visits are with a board certified plastic surgeon that's going to see you, because that's kind of like what you're paying for.
Right.
And the prices I saw from like that firm in the UK were pretty close to what you pay for a pretty decent like board certified surgeons in the US. So there's like just no excuses. So you got to make sure what you're paying for. Your post-operative care is very important, because if your post-operative experience isn't as good as somebody else's, that's going to make a world of a difference as far as what your recovery is and what your thought process is from like going through procedure like that.
Yeah, like people ask us to like price match like places like MIA, that's like Chop Shop. They're actually probably adding one to Scott's or somewhere in Arizona. I don't know.
They're going to come around.
Yeah.
They're going to be around.
Yeah.
They'll be here.
Yeah.
They'll be here.
Keep an eye out.
Yeah. When you're doing $4,500 BBLs, I don't know.
Hey, that's going to be your first red flag.
Yeah.
Right
if that's another red flag. If you're like considering a place that's like $3,000 to $5,000 cheaper than anywhere else in that town, you're paying for what you get.
Hey, a $500 BBL though, I'll take it. It'll look good, and then I'm probably gonna have.
That's what you'll say. That's what you'll
sepsis.
say, and then you'll get somebody like we've seen. Like people get free silicone injections in buttocks by uncertified people.
I've seen.
And then we literally have to cut off their ass, and then it migrates in their leg.
Their ass is actually like concave. So they have like less ass than they had before the BBL.
Yes.
Unfortunately.
Yeah.
Well, it's one of those things that it happens to you, then you're scarred for the rest of your life.
You didn't think about it, and there's nothing to change that. Like,
no worries, that'll be the next trend. We're not doing Kim K butt anymore. We're doing concave ass.
Yeah.
Okay, so we're doing divot in the ass.
We're gonna
it's
do
up and coming. We're
I think it's
trendsetting.
called, instead of Brazilian butt lifts, we're gonna call it
Come on, spit it out. You got this.
It's gonna be a little racist.
The white hick butt.
The white girl butt. No worries. Hey, I'm only half white. It's okay. I'm not offended.